I was always stuffed up. I couldn't really breathe out of my nose so great. Constantly getting sinusitis and like a lot of pressure on my cheeks and my sinuses, and it was very painful and difficult to breathe.
Mm-hmm. And what medications had you tried prior to having anything done?
I tried a lot of over-the-counter medicine like Flonase, a few nasal sprays, and nothing really worked. I couldn't find anything to really clear me up and help me breathe any better.
Mm-hmm. And then you were getting multiple infections a year. I mean, I put you on at least 3 or so courses of antibiotics.
Yeah, like maybe every 2 months, every month. It was a lot. It was uncomfortable.
Okay. So Nick actually had a lot of findings on his CAT scan. He had a significant septal deviation to the left, so he was completely blocked off on that side. He also had significant ethmoid disease. His maxillary sinuses openings were like completely stenotic. You had like no airflow into your sinuses at all.
Yeah.
Same thing with the sphenoid. So what we ended up doing for him in the office while he was awake, this was about a month ago now, we did a septoplasty, we did an inferior turbinate reduction, we dilated the maxillary sinuses, the frontal sinuses, the sphenoid sinuses, we did an anterior ethmoidectomy, and that was really it. How are you feeling after the procedure?
After, I feel great. I can actually breathe through my nose. There's no pressure. I feel like a lot of the swelling in my cheeks went down,
Mm-hmm.
and I breathe better than ever.
Were you scared before the surgery?
Not really. I was pretty comfortable with my doctor, so you were very knowledgeable about it, and it made me feel comfortable, so I wasn't really too nervous.
What was the process like during the procedure itself?
Very calm. The music was nice. The little ice pack was nice, and there wasn't much pain. It was pretty comfortable for what we call the sinus surgery. I was expecting it to be a lot worse, but it was much better than I thought it was going to be.
And what about the recovery? How was that?
Recovery was fine, as long like I did the rinses, and that really cleared everything out. I thought it was going to be much tougher to not blow my nose for a week. But once I got through that and doing the rinses and clearing everything out, I felt great.
Good, good. All right, so, I mean, there's many benefits to doing a procedure like this in the office. You're a pretty complicated case that, for the most part, would typically go to the operating room at other centers, but here we really invested in neuronavigation systems and surgical technique to, as you can see, safely and very effectively in your case, get this done in the office. So thanks for making the video with me.
Thank you.
I'm glad you're feeling good.
Thank you.
Thanks, Nick.
Thank you.